Welcome back. We're talking about oxidative therapies with Dr. Shallenberger. Big category is infections. Like you said, in conventional medicine, yes, you have some antiviral drugs. They have very high side effect potential. We know now over 3% of the world's population has hepatitis C, for example. I know the Centers for Disease Control now recommends primary physicians screen all the baby boomers for hepatitis C. Then you got the hepatitis B, you've got Epstein-Barr virus. Can you tell us a bit more about using it to treat infections? Because that is very, very unique, and I think more goes back to its origins, right?
And it's another one of those things that in medicine, when you're a doctor and you have a treatment that'll work really well, and there's nothing else effective for it, you like that treatment.
Right.
And this would be like hepatitis. Now, they do have some effective treatments for hepatitis, but they're toxic,
right,
and they're not always effective.
And I think about half of people can't make it through the treatment.
Yeah, and that doesn't work that often.
Right.
But this treatment really works very effectively, and with zero side effects.
Well, which is very important. How about take the patients with the flu, respiratory tract infections, which tend to be mainly viral. 1 to 2 treatments.
Now, yes.
Maybe a typical course of treatment, which is not a whole lot.
I'm thinking, yes, how about some of these cute viral things that you hear about, like West Nile?
Right.
Or hantavirus.
Right.
Or what's the more recent one is the swine virus. But those things, we've had documented cases of those people coming into the clinic quite sick. The next day they're okay.
Wow.
It's that dramatic often.
And how about the potential for toxicity? I mean, there's going to be people wondering out there, well, you're putting ozone into the bloodstream. Tell us a bit more about the procedure itself, and then, toxicity.
Well, anything is toxic. We know that, but it's dose related.
Right.
If you do this procedure properly, and like I said, the Germans have been using it for 50 years, so we pretty much know how it should be done properly. You do this properly, it is absolutely safe. There's just nothing that can go wrong.
I've never heard of a problem, but you've got a lot of
experience. If you do it properly, nothing's going to go wrong, and it's very easy to do.
And how long does a treatment normally take? Say you're doing an ozone treatment intravenously.
Well, you can do the treatment a number of ways. I can treat your blood.
Yeah.
I can treat it as an enema, give it to you in that fashion.
Right.
I can ozonate water and have you drink it. I can ozonate oils and have you apply the oils topically, or even eat the oils, like ozonated safflower oil.
And you, I know, have an inhalation treatment too.
And there's a version of an inhalation treatment where you bubble it through olive oil and then you inhale that. You can administer it as a sauna, so it will absorb through your skin into your body that way, which is a very effective treatment.
Very
as
versatile.
Well. We do all these things in the clinic.
Now, I know a lot of the viewers are interested in cardiovascular disease. How about Ozone? We're using it for people with existing heart disease. Again, the premise is get the oxygen to the cells, reduce inflammation, stimulate tissue healing.
Yeah, with heart disease, everybody knows that if you've got a blocked off artery, you've got a problem.
Yeah.
Because you can't get the oxygen to the heart cell. So you clean out that blockage. That's a good idea. But here's the problem. Even then, the heart cell can't use the oxygen efficiently. So you've got to do both. You've really got to do something to clean out the blockage and something to build up the heart cell so it utilizes the oxygen and is getting more efficiently. So it makes common sense to put two treatments together, one like chelation therapy, which will have an effect of delivering more oxygen to the cells, and then another ozone therapy, which by its oxidation stimulus will cause the cells to use oxygen more efficiently.
Are those two treatments done simultaneously, or are they spread out as alternate treatments?
We do them one right after the other.
Nice.
Do the ozone first, follow it up with the chelation.
Oh, okay.
Do it all in one day. It takes maybe 3 hours.
Wow. Impressive.
In fact, I'll tell my patients, ozone therapy in many ways is exercise in a bottle. You don't actually have to come in here and get it. If you're strong enough and you're healthy enough, go out there and perform the exercise on a regular basis. Single best thing you can do to stay healthy.
Well, thank you, Dr. Shallenberger, for that great information. And I know for the viewers out there, this is a lot of new information that you can apply to your life. You can apply to any condition you have. Excellent, excellent information.